Good morning and welcome. My name is Jamie Waslowski, and I'm the President and CEO of the Methodist Healthcare Ministries of South Texas. Thank you all for joining us today as we release the latest survey data on Texas children and learn how these findings may have lasting impacts on their quality of life unless we take action now to eliminate system barriers. Texas families have endured extreme hardship these past 12 months as a result of the COVID-19 pandemic, and we have some time to go before we can safely see our way back to a life of economy that supports resilient families and thriving communities. While the burden has been unduly felt by many, we know that our children have been greatly impacted by the pandemic, as they found themselves removed from their classmates and their teachers, quarantined in their homes for the better part of a year with little social contact outside their safety bubble. Adding to these circumstances, we also were forced to acknowledge our lack of investment in broadband infrastructure in both rural and urban communities, leaving many children unable to virtually connect with their schools and teachers for classes and guidance. Food insecurity has also been a long-standing problem for Texas families, and we saw this worsen as working parents lost their jobs and struggled to pay for housing, utilities, and food. At the end of 2020, 21% of Texas households with kids reported not having enough food to eat. That's 1 in 5 families struggling to put food on the table. This past year, Methodist Healthcare Ministries moved quickly to organize its partner operational sustainment team and deploy emergency and recovery resources to current funded partners and other local organizations working to assist underserved families. Over the past 12 months, we've provided close to $2 million in funding to 7 food banks in our service region, with another $600,000 on its way at the end of March. While these types of emergency responses are critical, they do not get to the root cause of the problem or identify solutions to remove the social inequities in our system. In terms of the physical and emotional health of our children, Texas currently has the highest rate of uninsured children in the country at 12.7%. That's twice the US average. Our efforts to enroll and cover children through the federal state Medicaid program and the CHIP program are woefully underfunded. Of the kids who lose Medicaid coverage due to the monthly income checks, 9 out of 10 do so because of procedural reasons, such as errors or delays in the monthly paperwork. Only 1 out of 10 is removed from Medicaid because the household income actually increased. We look to our state lawmakers to remove these eligibility barriers and streamline enrollment processes so that we can achieve continuity of care and avoid future health issues as children become adults. And that's why we're here today. There's always a need for research and valid data. These tools are how we begin to assess the issue at hand, and they lead us to debate and implement stronger public policies that are directed to remove the inequities in our healthcare and educational systems, our food distribution, and other economic barriers. Methodist Healthcare Ministries has been a longtime partner with every Texan in supporting grassroots advocacy and funding research projects such as biannual Texas Kids Count Report. This valuable report is used by many local and state policymakers to craft ordinances and laws that are aimed at keeping Texas children safe, healthy, and educated. So thank you for joining us today for the release of the latest data in our Texas children. We hope you continue to connect with us as we direct our efforts toward long-term strategies and investments that will ensure a thriving future for our next generation of Texans. Now I'd like to introduce you to Amy Canop-Marbutis. Amy is a research and data director at Every Texan, where she oversees data-based advocacy projects such as Texas Kids Count Report and fee-for-service data offerings that advance equity for every Texan in the areas of quality healthcare, education, jobs, child well-being, and more. Amy came to Austin, Texas via the LBJ School of Public Affairs at the University of Texas at Austin, where she graduated top of her class with a master's in global policy studies. Amy?
Thank you, Jamie, and good morning, everybody. I would like to dive right into our data presentation for this morning. So give me a moment to bring up my screen. I know we spend a lot of time online these days, so it's a great time to do a little morning calisthenics, grab a second cup of coffee, and I hope this presentation will be engaging for you. All right, here we go. Again, my name is Amy Knapner-Butis. I'm the Research and Data Director for Every Texan. At Every Texan, we believe social justice requires public policy. I also want to acknowledge Methodist Healthcare Ministries of South Texas. Thank you so much for your financial support of this publication. With the provised opinions I'm about to share are those of Every Texan and do not necessarily reflect the views of Methodist Healthcare Ministries. We only have about 20 minutes this morning to give you an overview of the report, so I'm only going to cover topics at a high level and then encourage you to check out our online report for more information on topics like food security, health insurance, economic opportunity, education, support for immigrant families, impacts of COVID-19, policy recommendations, and more. I'll also take a moment at the end of the presentation to answer some of your pre-submitted questions. And before I dive right into the data, I just want to share that throughout the report, we will be using the term Hispanic to reflect the original data sources the report is drawn from, but we recognize populations may prefer to self-identify as Latino, Latinx, or otherwise. Also, the terms white, Black, and Asian throughout the report are non-Hispanic unless otherwise specified. I want to flag that breakout data for Asian populations is provided when available, but will otherwise be included in the category Other. And Other can be a broad category that includes groups like Native Hawaiian and other Pacific Islanders, American Indians and Alaskan Natives, and 2 or more races that sometimes cannot be broken out due to low sample size numbers. Asian itself is a very broad category, including Asian Indian, Chinese, Vietnamese, Filipino, Korean, Japanese, and other per the US Census Bureau. So I just wanted to start off to acknowledge that a lack of reliably disaggregated data from all sources obscures the different experiences that each of these populations may face, and that we believe increasing data disaggregation in the future is an important policy priority. So with that, let's dive into food security. We know that a child's potential to thrive is limited if they face hunger. Not having adequate nutrition impacts how children grow, play, and learn. Texas has one of the highest rates of child food insecurity in the nation at nearly 22%, or almost 1.6 million children. Since the pandemic, the number of food insecure children has been rising at unprecedented speed as COVID-related unemployment puts many families in financial stress. For example, in November 2020, 2.6 million adults in Texas reported their household did not have enough food to eat in the past 7 days. A family faces food insecurity if they don't have the financial resources to ensure full and consistent access to food. For a child to face food insecurity is particularly alarming because parents already tend to eat less or skip meals to make sure their children have something to eat. Increasing rates of child hunger suggest families are in significant distress they cannot shield their children from. Going into the pandemic, as shown by the chart on the left, 13% of all Texas households had low food security from 2017 to 2019. That means they reported having reduced diet quality and variety. Black households were almost twice as likely at 25% and Hispanic households at 17% to face this challenge, with white households being less likely at 8%. The same pattern persisted for households experiencing very low food security, meaning they eat less or they skip meals multiple times, at 5% for all Texas households, but 11% for Black households. Food insecurity impacts communities across the US, but we know financial stressors at the root of food insecurity disproportionately impact Black and Hispanic communities due to the cumulative impact of racial inequity and disparities in opportunities. Rates of food insecurity in November 2020, for example, were high for Texans across the board, but at least twice as high for Black and Hispanic adults as white adults reported for households with children. Rising unemployment is one driver behind food insecurity, considering Black and Hispanic households are more likely to have workers in low-wage jobs impacted by the pandemic due to the structural inequities in accessing education and employment opportunities in our system. Also, historical exclusion from wealth-building opportunities for Black and Hispanic families means that they had fewer assets to fall back on compared to wealth accumulated by white families that did not face these exclusions. Finally, disinvestment in low-income communities results in limited access to stores selling healthy food, contributing to the risk of the only accessible food being poor quality, unhealthy, and often expensive. Another often overlooked population that suffers from food insecurity is college students. Over 70% of college students nationwide are non-traditional, which includes being financially independent, working full-time in school, or taking care of dependents. However, most college students are not eligible for SNAP benefits. College students often turn to food pantries, and by September 2018, over 650 colleges nationwide reported having a food pantry on their campus, which speaks to a widespread acknowledgement of the food insecurity students face. This chart explores SNAP enrollment pre-pandemic. SNAP is the Supplemental Nutrition Assistance Program, the leading federal anti-hunger program. This chart explores how many children in Texas in different counties were enrolled in SNAP versus how many were likely eligible, with the red line representing what would be perfect full enrollment if all eligible children were enrolled in SNAP. As I will give you the link to our full online report later, you'll be able to interact with this graphic, choose your county, hover over the bubbles, and see all kinds of interesting information. As I said, SNAP is a leading anti-poverty and anti-hunger program. And on average, SNAP kept 742,000 Texans out of poverty each year between 2013 to 2016, which included almost 400,000 children. Eligibility for SNAP is based on meeting a low income requirement, and the average SNAP benefit in Texas is $1.28 per person per meal and reaches about 1 in 9 Texas residents. In 2018, for example, 28% of Texas children were enrolled. There have been rapid and significant increases in SNAP enrollment due to COVID-19, and in Texas, overall SNAP cases jumped from about 1.4 million in February 2020 to almost 1.8 million in September 2020, which is an increase of nearly 350,000 cases. And I want to note that SNAP cases can include more than one individual, which means even more individuals receive SNAP benefits than that. COVID relief measures included a boost in SNAP benefits, but the already poorest households which were receiving the maximum benefit saw no increase. Nationwide, we also know about half of households that receive SNAP benefits continue to experience food insecurity, which suggests a need to expand benefits further. Now to dive into health insurance a little bit. We know supporting children's health gives them the best chance of succeeding in school and later in life, and providing healthcare coverage is one way to provide wide-ranging and long-lasting impacts on health, educational, and financial outcomes for both children and their families. Yet, in 2019, after years of improvement, the number of uninsured Texans worsened for the third year in a row, reaching 5.2 million Texans uninsured, almost 18% of Texans of all ages. That was the worst rate since 2014 and twice the national uninsured rate. Children, by this definition under age 19, are far less likely than adults to be uninsured because they have access to Medicaid and CHIP. Yet, Texas still has the worst child uninsured rate in the US at 12.7%, which is more than twice the US average. Nearly 1 in 4 uninsured children in the US lives here in Texas. By protecting all children's right to affordable and accessible healthcare coverage, we invest in the success of future generations and set up more equitable conditions to see children thrive. Texas is one of only 12 states that has not accepted federal funds from the Affordable Care Act to cover uninsured adults. Texas studies estimate the state loses at least $5 billion a year from not accepting federal funding under Medicaid expansion. States that chose not to expand Medicaid have seen uninsured rates for children grow at almost 3 times as fast as states that do expand Medicaid. Children in states with expanded Medicaid are more likely to be uninsured because parents often get coverage for their children at the same time they gain health coverage for themselves. Additionally, young adult Texans, ages 19 to 24, could benefit greatly from Medicaid expansion. Today, more than 1 in 3 are uninsured, but that could improve to only 1 in 5 post-expansion. We know uninsured rates vary by county in Texas, and you can explore more about this data using our interactive map feature online. Enrollment options for children that don't have private health insurance plans, such as through employers, include Medicaid and the Children's Health Insurance Program, CHIP, both of which are the largest government-sponsored programs available. Medicaid and CHIP provide health insurance coverage for 77% of Texas children living in or near poverty. But after 10 years of enrollment growth, there was an alarming decrease of 237,000 children enrolled in Medicaid and CHIP, about a 7% decline between the end of 2017 and February 2020. Part of this is because to confirm Medicaid eligibility, Texas conducts income checks multiple times a year rather than simply yearly. Under this policy, parents must respond to income checks within 10 days with documentation to confirm a child's eligibility for Medicaid, or they lose coverage. Thousands of eligible children lose Medicaid coverage every month under this policy, forcing children to miss appointments or pay out of pocket until they can confirm their eligibility. We know that families with the support of Children's Medicaid are able to spend more on food and housing and often see decreases in medical debt. Medicaid in general is one of the largest anti-poverty programs nationwide and keeps millions of people out of poverty. While states may be tempted to cut spending on programs like Medicaid to meet short-term budget needs, the long-term impact of Medicaid has proven to more than justify the return on investment and is associated with improved health, lower rates of disability, higher educational attainment, and greater long-term financial security for children. In particular, Hispanic children continue to experience a high uninsured rate, and Texas holds the largest share of the nation's uninsured Hispanic children, 36% of the national total. Hispanic children in Texas are almost twice as likely to be uninsured as others. Causes of low health insurance rates are linked to both socioeconomic and immigration status. Enduring inequities in accessing education and employment opportunities mean Texans of color and immigrants are more likely to work in low-wage positions deemed quote-unquote essential. But despite being labeled essential, these roles often do not offer employer-sponsored health insurance. In recent years, the now defunct public charge rule and other immigration policy changes proposed tying lawful immigration to immigrants' use of public benefits, which had a chilling effect on families' decisions to keep or seek health care. In order to successfully enroll more Hispanic families in health insurance, we need targeted Medicaid and CHIP outreach conducted in individuals' primary language and by trusted community members. More on that to come. Health is also determined by economic opportunity. And we know that the employment benefits we offer parents directly impacts their children's opportunities to stay healthy. In Texas, 62% of workers do not have access to even unpaid family and medical leave under the Federal Family and Medical Leave Act. Without these benefits, Texas workers who need to take time off to care for children and family members may have no choice but to lose wages. Families are forced to choose between prioritizing the health of their family and going into work. In Texas, 40% of workers do not have paid sick days. If parents have access to paid sick leave, they're more likely to stay home when they're sick, preventing illness from spreading, and allows them to stay home with a sick child and not send them into school. Simply having a job and working full-time is not enough to make ends meet in many parts of Texas, with a state minimum wage of $7.25 an hour. The rising cost of housing makes living in cities impossible for many families. Some estimates show a minimum wage worker would have to work 95 hours a week to afford an average one-bedroom rental in Texas. This affordability crisis is even worse in urban areas and for women and people of color. A long history of discrimination and restricted opportunities has limited wages for women and people of color compared to their peers, so they take home less money for the same hours of work. If the jobs that parents hold do not pay a living wage, we risk keeping families from reaching financial stability despite their best efforts to get ahead. Although evictions were halted through the end of this month, the threat of homelessness has become real for families who need to budget too much of their take-home pay for rent despite their best efforts. As you can see in this chart, which uses search data from Aunt Bertha, the social care network, which is an online platform which helps people find help from social service providers, searches for food, health, and particularly housing support all spiked following the onset of the pandemic. Raising the state minimum wage, enacting paid family and medical leave, and paid sick leave would help to ensure working families don't need to sacrifice their health to stay afloat. We also know educational pathways are not the same for every Texan. The pandemic highlighted some additional obstacles students need to overcome to get access to the same educational opportunity as their peers. As schools moved online during the pandemic, or some hybrid model, Texas students dealt with one of the worst home internet access rates for children nationwide. Only 7 states have worse rates of access to the internet and to a device at home for children. In particular, rural communities and communities of color in Texas suffer the lowest connectivity rates, meaning these students are most at risk of falling behind during our public health crisis. For more on that, you can check out Every Texan's blog on 3 ways to address Texas's digital divide. Now to dive more into support for immigrant families, as a refresher, in October 2018, the Department of Homeland Security announced a proposed change where applicants seeking green cards or immigration status change would be penalized for using government benefits. Some early leaked drafts of that regulation showed the government was considering penalizing a wide range of benefits, health insurance programs like Medicaid and CHIP, nutrition programs like SNAP, WIC, and even free and reduced lunch. In the confusion, a climate of fear developed within mixed immigration status families and communities about getting assistance. It had a chilling effect on families' decisions to seek or keep healthcare, nutrition benefits, and even a lowered number of routine doctor's visits and vaccinations. Although, as you can see in these charts, 89% of Texas children in immigrant families are still US citizens. Families may choose not to participate in programs that would benefit their citizen children out of fear of negative consequences for their family members. Over 1 in 4 Texas children has a parent who is not a US citizen. Although the Biden administration recently rescinded the public charge rule, service providers and advocates believe years of new outreach will be needed to overcome fears created over the last several years. Beyond that, Texas needs to make sure immigrant families are not blocked from accessing public benefits that increase financial security. Texas is one of only 6 states that explicitly excludes immigrants with permanent status from enrolling in Medicaid, although the benefits of Medicaid enrollment on children's health are well documented. Now, to dive a little more into the specific impacts of COVID-19, as shown by the US Census Bureau's Household Pulse Survey, 20% of all households with children in Texas, but 37% of Black and 34% of Hispanic households had little or no confidence at the end of December that they would be able to pay the next month's rent. Pandemic job losses hit Texans hard, with over 4.2 million Texans filing for unemployment relief from mid-March 2020 through mid-January 2021. The onset of COVID-19 only worsened racial and ethnic inequities that already existed and brought new challenges to the forefront. The sectors like restaurant, service, and retail industries were the sources of income for many low-income families of color. With job losses also came the risk of losing employer-provided health insurance for those who were lucky enough to have it, or losing the means to pay for healthcare. For those keeping their jobs, workers also faced increased risk of COVID-19 exposure. Some estimates show that of person years lost due to early death from COVID-19, meaning the difference between a person's age at death and their life expectancy, 60% of that loss came from Hispanic families, although they make up only 40% of the state's population. About 1.6 million Texans are estimated to have lost their employer-based health insurance from March to May 2020. Those who lost employer-sponsored health insurance became eligible for special enrollment in the marketplace for 60 days following job loss, which helped some individuals avoid gaps in coverage. But for those who became unemployed in jobs that didn't offer employer-sponsored health insurance, no such special enrollment period was allowed by the Trump administration. In many states, people could have become eligible for Medicaid due to a drop in income, but in Texas and 11 other states without Medicaid expansion, people with incomes below the poverty line were left out. Although a lot of this data is alarming, I want to emphasize that there is hope. There are practical fixes the state can easily make this legislative session to improve conditions for Texas children and families. I won't dive into all of them into great detail, but you can learn more about our policy recommendations on Every Texan's website, everytexan.org. We have specific recommendations on food security, health insurance, economic opportunity, education, increasing support for immigrant families, and equitable economic recovery. All this information and more can be found on our interactive data report online. Here's a little preview pane. The URL is everytexan.org/kidscount2021, which will also be sent out after the event. You can scroll through the website. You can see we have a table of contents, hyperlinked. We have a lot of the charts and data you've seen today and more, including a interactive data dashboard where, as I said, you can use drop downs and hovers, explore data specifically for your county, disaggregated by race and ethnicity, and more. If you want even more data than that, you can check out the Kids Count Data Center. Kids Count is a national and state-by-state effort to track the status of children in the US, supported by the Annie and Casey Foundation. If you check out the Kids Count Data Center, you can find extensive child well-being indicators on kids across the US and for each of Texas's 254 counties. Finally, I'd like to take a moment to answer a few audience questions before we bring on our panel and panel moderator. Some pre-existing, pre-submitted questions that we received with event registration that I wanted to take a moment to address included: how has the COVID-19 pandemic and winter storm exacerbated inequities, particularly racial, that you see in the data? As you've seen throughout this presentation and more on the website, we know that racial and ethnic inequities existed before, and that the stressors of these events have only made disparities worse. Another question: how will Medicaid be affected by this data and policies? I think this presentation has hopefully made clear that the data shows we need to expand Medicaid in Texas. How to get involved, how to truly make an impact. I would point you to one of our efforts with our partners. You can check out Sick of It TX, hashtag Sick of It TX, which is part of our efforts to rally people around expanding Medicaid in Texas. Finally, there is a question on, please discuss youth mental health, adverse childhood experiences, and maternal mental health. Throughout the report that you'll see online, there's ample discussion of how food insecurity, lack of health insurance, and lack of economic opportunity are intertwined with toxic stress for families. And finally, will there ever be a single place we can go for data? I really appreciate this question, and I want to say, try to check out the Kids Count Data Center for a start, and I hope someday we can move towards a system where everyone has access to data in an easy to find and navigate place. We hope this report is a good start. I'm going to stop sharing my screen and take this opportunity to bring on our panel moderator, who is Jeremy Everett, the founder and executive director of the Baylor Collaborative on Hunger and Poverty.
Hello, everybody. Amy, that was an excellent presentation. Our organization is used to your organization, Every Texan, producing top-notch reports on an annual basis. And so we are grateful for the time and energy that you all put into this. We know that it represents an extraordinary amount of work over this past year and during incredibly difficult circumstances where we know the needs of Texas families are rapidly changing. So kudos to you all for putting this report together. As I mentioned before we started today, I do look forward to the report at some point, hopefully in the next decade, when you all can say that when we have a kids count report, that yes, they do, and that in Texas we are doing a good job of supporting our children and our families. But as of today, obviously we have a long way to go. Fortunately, we have experts, people that have been doing incredible work for decades, trying to address these health inequities. And so fortunately for you all today, we have 3 of them who are going to serve as panelists to help you understand how they are reading this report and what they are seeing with their work directly on the ground as it relates to our Texas families. So our first expert that I want to introduce you to is Anna Hardaway. Anna serves as the Chief Programs Officer at Children at Risk, and for the past 2 decades, Anna has served as an educator and an expert in strategic organizational support. We're grateful to have you, Anna. We're also welcoming Dr. Lauren Gamble. She is a pediatrician and a fellow at the LBJ School's Center for Health and Social Policy. She also serves on the executive board of the Texas Pediatric Society. Dr. Gamble, we're glad that you're here. And we're also welcoming Katie Mitten. Katie leads Texans Care for Children's work to improve children and family health. Katie's career has been focused exclusively on the public good in various capacities at Feeding Texas, Communities in Schools, and the Austin Child Guidance Center. So to the three of you, we are very fortunate to have you on this webinar here today. We're grateful for Methodist Healthcare Ministries, certainly Jamie Waslowski and his leadership, and Chris Yanis and her logistical support to put this event together, and to be able to have you serve on this panel. So I want to dive right in. Everybody's anxious to hear what your experiences have been, certainly this past year, but also as it relates specifically to this report. So if you can, tell us a little bit about your work and your organization's role in addressing health inequities. And just so you know, for our audience, we're going to go in alphabetical order. So Anna's going to start us off each time, and then she'll be followed by Katie, and then Lauren will bring that each question to conclusion. So Anna, why don't you start us off? How is your organization addressing health inequities?
Thanks, Jeremy, and thanks everyone for joining today. Oh my goodness, what an amazing conversation. I am super excited to be here representing children at risk and the families of Texas. I will start out by just saying that Children at Risk has been around for 31 years, and we primarily serve as a bridge between research and policy on all things related to children and families, but specifically around education, health, parenting, and on the issue of human trafficking. Those are kind of our big four issues. Although one of the most exciting things that has come about in the past year is the Texas Family Leadership Council. So any of y'all who have worked with Children at Risk know that we are known for being a true collaborative partner across the state and beyond. And the Texas Family Leadership Council is a group that gets together every single week and has since for almost an entire year. And we started talking about COVID, and we started talking about health inequities and the issues that other nonprofits are experiencing across the state, both direct serving and those that deal with research and policy. And so that council has broken off into several work groups, and we're still meeting every week, and folks are still showing up every week to hear about all the important issues that we're going to talk about today: feeding, housing, insurance coverage, preventative care. And so I'm just feel really fortunate to be a part of that work, in particular, I think, as it pertains to how much data has come to the forefront in 2020 and 2021.
Thank you, Anna. Katie.
Hi, thanks for having me. I work at Texans Care for Children. We're a statewide nonprofit, nonpartisan, multi-issue children's policy organization. We develop policy solutions, we produce research, and we engage in Texas community leaders and educating policymakers, the media, and the public about what works to improve the well-being of Texas children and families. And we really envision a Texas in which all children grow up to be healthy, safe, successful, and on a path to fulfill their promise. Our work covers child protective services, juvenile justice, children's mental well-being, maternal and child health, early childhood, and the ways each of those policy areas work together to shape a children's lives and the future of Texas. I lead our work around children's health policy, including making sure kids have access to health coverage and access to quality health care. And I also work on our having access to early childhood intervention for babies and toddlers with delays and disabilities. Specifically, we work to address health inequities by advocating for and passing policies that increase quality and access to healthcare for kids and their families. We complete research to investigate and raise awareness around challenges and inequities that families face in Texas. And we really try to get access to disaggregated data whenever possible in order to better understand the inequities and develop policy solutions to address them. So that's a little bit about Texans Care, my role, and what we do to address inequities. I'll pass it over to Lauren.
Hi, thank you all. So I'm a pediatrician. I specifically take care of kids when they're admitted to the hospital, and I am here representing the Texas Pediatric Society, which is an organization of over 4,400 pediatricians who are dedicated to the health and well-being of Texas children. So our organization works to address health inequities in all sorts of ways. We advocate at the clinical level, we advocate at the community level, and we do a ton of advocacy at the legislative policy level. And so we follow any and all legislation that impacts the health and well-being of children and their families. And really what we bring to the table is our clinical experiences. So we see how the policy plays out day to day in the hospital room, in the clinic, in the office. And we bring those stories of patients and their families to policymakers to help shape the healthcare policy landscape. I also want to add that I'm super, super thankful for everyone that's here today, because while we see how these policies play out in the clinical setting, we a lot of times don't necessarily have that big data behind to support what we know is happening. And so collaborating with everyone here, with Kids Count, with Methodist Healthcare Ministries, with everybody on this panel, with everybody in the audience is so, so incredibly valuable. And so I'm super excited to be here and really appreciative.
Well, it sounds like that most of you have, or all three of you have more hours in your work week than I do. Because Lauren, I don't know how you're a pediatrician and you do this on a policy level at the same time. My sister-in-law is a pediatrician in Houston, and we are very grateful for your commitment to this work. And our organization has had the privilege of being able to work closely with Children at Risk and Texans Care for Children now for over a decade. And they are true leaders in this space. And so with all that in mind, with the experience that you all have had, this year has brought just an immense amount of hardship for families in Texas and around the country and even around the globe. How has COVID-19 exposed inequity of access to preventative care for children and their families in Texas? And how do we compare with other states? Are we doing as well as everybody else? And specifically, have you identified if race plays a major factor? Of course, that was one of the things that Amy pointed out in her report, but are you seeing that firsthand in your work as well? So Anna, I'm going to kick it over to you to start us off.
Certainly, and thanks for the question. That's a big one. It's a couple of big questions in there, so I'll try to be as succinct as I possibly can. I'll just start out by reiterating that the social safety nets for children, particularly children who are marginalized populations, were already stretched before COVID, and in many ways woefully inappropriate to meet the needs of families in communities of color. But what COVID did was, first of all, shine a light on the inequities and on the inequalities that many of us who work in the nonprofit world kind of have taken for granted, that we knew this, right? Like we have all this data at our fingertips and we think about it every day. But while it's really unfortunate, there's also an opportunity here, right? So that now others who may have pushed the data aside or assumed that it was, coming from one angle or another, we're in a time where the data cannot be denied, and the information about how those social safety nets that were stretched have now been demolished. That they can't, we can't call it a political issue anymore. This is a public health. These are public health issues that we now must address. So while this has been a really horrible time for children and families that were already dealing with significant need, it's also an opportunity for those of us who've been looking at the data for decades can now begin to be a stronger voice. Race absolutely plays a factor. I would say that first of all, how does Texas stack up? Well, Texas stacks up in a way that it's really hard to say with numbers, because I think that the biggest impact is that we have such a diverse population, and that we serve so many of the nation's children right here in our state, right here in our backyard, that any of the list, the ratings lists that you look at, really any of those that show negatively on Texas really are a huge indicator of major problems in the country. So I think that's really important to point out. And I also think that I'd love to share a couple of thoughts. We had a programs event last week called The State of Black Children in Texas. And a couple of the pieces of data that came out, which are also reflected in the report, in the Kids Count report, is that many of the children in Texas who are in foster care, in fact, 21% of the children in foster care in Texas are Black children. In the state, Black children make up about 12% of the child population. So that was one of the really striking statistics that stood out to me, along with many others. And then also there was a lot of striking data around mortality rates, around births of Black children and Black infants, which I could share some of those, but we need to make sure that we're thinking about race when we're thinking about health disparities, and I know that's kind of an understatement, but ultimately, little Black lives matter too. One of our presenters said, little Black lives matter too. And we've been saying that to each other all week long in the office since the presentation last week. So I think there's a lot of great information to share, and a lot that came out of the Kids Count report. And I appreciate the focus on race and equities in the Kids Count report this year.
That's excellent. One thing I think that is important that you're highlighting is if we want to move towards reconciliation as a community, as a society, first we have to unpack the inequities. We have to see what the realities are. And my organization comes from a strong faith perspective. I would say that we have to ask for forgiveness. We have to, that's something that we have to reckon with before we can run to reconciliation. We have to deal with those inequities and make more just systems before we can hope for reconciliation. So I appreciate the work that y'all doing. Katie, why don't you speak to that?
Yeah, I think there's 2 or 3 big things that come up when I think about COVID and preventative care and inequities during this time. The first one has to do with, and I think we'll talk a little bit more about this later, but has to do with broadband internet access. With COVID, a lot of people have been able to get their preventative care needs met via telehealth. But we've also seen that not everyone has access to this virtual option, and that access to broadband internet is limited in some areas of the state, and a lot of that has to do with your socioeconomic status as well. So I think that COVID has opened up a great opportunity in order for families and children to access preventative care through virtual options, but it's not equitable in terms of who has access to that. The second big thing I thought about when you asked this question is about access to coverage. Having access to insurance, impacts the ability to access preventative care. If you don't have insurance, you're probably not going to get preventative care. Here in Texas, children of all ethnic groups have much higher uninsured rates than the national average. We have, as Amy pointed out, we hold the unfortunate title of the worst uninsured rate in the country. 12.7% of kids are uninsured. That's over double the national average. And when we look at, if we're looking at all of the kids in the US, 1 in 4 of those uninsured kids in the US live in Texas. So we have a lot of work to do to make sure that all kids are covered and that they have the coverage they need so that they can get the preventative care that they need. And then if we look at that from an inequity perspective, The census data shows that the uninsured rate for non-Hispanic white Texas children is lower, 8.3%, which is still higher than the national average. The national average is around 5.5%. So 8.3% of kids in Texas that are non-Hispanic white don't have insurance. That would still put us as, if we're just looking at white kids in Texas, that still puts us as the 6th highest uninsured rate in the country. When we look at Latino kids, it's much higher, as Amy pointed out in her presentation. Other states that have high proportions of Hispanic populations, New Mexico, California, Arizona, they have lower uninsured rates than Texas. So I think we kind of need to look to some of our neighbors, look for opportunities and solutions to try and reach children of color and Hispanic children in particular here in Texas, because there's some other things going on, such as the public charge and fear of accessing these services, that we could do more at a policy level in order to address, to make sure that all eligible kids have access to insurance.
Thank you, Katie. I've got one follow-up question for you about broadband specifically. Obviously, I think pre-pandemic, we didn't really think about broadband as a lifeline, but you referenced telehealth and how in many cases that's how many of us are accessing preventative health care, mental health care, and so forth. In addition to that, we also know that our kids are dependent upon broadband if they're going to have school access. And our organization works with rural school districts around the country, and we know that many of them have not been able to offer in-person options or online options because of broadband access. Can you tell us in Texas who doesn't have broadband access?
Yeah, that's a great question. I don't know the number off the top of my head exactly. I know that recently, along with over 100 other organizations, Texans Care for Children submitted a letter to the legislature around broadband access and making sure that we're looking at it more broadly than just infrastructure, not just looking at building a tower so that everyone has access to broadband, but also making sure that there's a larger conversation around access and digital literacy. And just because someone has access to internet doesn't mean they're necessarily going to be able to figure out how to download the right things in order to access a Zoom meeting, for example. So we need to think of it more broadly. So there's that letter, and I'm sure we could link to it in the chat. And I think that the data that we point to in that letter is that we're only one in 6 states that have no state broadband plan. So we don't have a broader plan of how to access that. And Amy's helping me out in the chat. She said over 30% of rural Texans did not have access to high-speed internet in 2016. 91% of white Texans are estimated to have both a computer and internet at home. Only 84% of Black Texans and 81% of Latinx Texans do. And she also provided us with another great data point that about 15% of all school-age children in Texas do not have a laptop, desktop, or tablet at home, and a rate exceeded by only 5 other states. Texas ranks 43rd in the country, both in terms of school-age children's access to paid high-speed internet and in terms of having a device or internet connection at home. So there's a lot of work to do, especially as this virtual life is not likely to go away anytime in the future.
That's right. For a state that prides itself in the rural nature and of our success and identity, it's certainly an area that we would love to see the state put more of a priority on. And I also think that it's not really fair having Amy, on board. Amy, I wish you and I went to college together. I think I would have done a lot better. But thank you for chiming in with your support on that question. Dr. Gamble, what are your thoughts on inequities as it relates to COVID-19?
Yeah, so thanks. I think as both Anna and Katie mentioned, the answer to this question could take all day. I mean, we could talk about this for hours, I think. And really, we're only beginning to understand the effects that COVID and the pandemic have had on children and their families. But I think just as Anna said, in many ways, the pandemic has really shone a spotlight on all of the problems that we've always known were there. And you mentioned race specifically, and absolutely that is a factor. And systemic racism, so let's just call it what it is really, rather than just saying racial disparities, but systemic racism is one of the biggest problems woven into our healthcare system. And so, of course, this spotlight has highlighted that as well for us. And I think it'll be years before we really understand the true extent. But for right now, and I'll just sort of speak to the medical side of things, we know with certainty that it's children and families of color, families and children facing economic instability, children living with food insecurity, really children and families that are marginalized in any way that are contracting COVID at higher rates, and they're the ones that are getting the sickest from COVID. So the web of inequality that COVID has helped expose is really complicated, and it includes all of the social determinants of health that we already recognized as problematic, and most certainly is helping us see some of the ones that we didn't even know existed or we didn't appreciate the extent of. So.
Thank you. And speaking of social determinants of health, oftentimes I think that in our society, particularly those of us who are in some sort of helping profession, we have a tendency to develop an expertise in one aspect of kind of the broader social determinants of health space. So, for example, our organization does a lot of work in the food security space. Many of you obviously work in the health equity space. Some of you work that are on the call today in the economic security space, and so we've all developed a specialization within each of these sectors. But for 2 decades, I lived and worked in low-income communities, and what we know is that it's the same family on the local level who struggles to pay rent, who has a job that doesn't pay adequate wages to be able to provide access, to food and healthcare and transportation costs. They live in houses that are oftentimes, just with a tremendous amount of issues in housing, and oftentimes are transient, moving from home to home. But oftentimes we treat these issues as a professional group who are addressing these things as if they are separate issues, but it's the same family on the local level that are bearing the weight of a lot of our broken social systems. So with that in mind, social determinants of health gives us a picture of holistic factors contributing to negative health outcomes. What are some of these contributing factors for families in Texas? And how do these factors correlate with negative health outcomes? Anna, why don't you start us off?
I'm glad you mentioned that some of us have built some expertise, and I want to hone in particular on one specific area that I think has come to the forefront in the last, I'd say, 5 years, and has become more of a focus for our country. Unfortunately, it was necessitated by lots of disasters that happened in the country at the same time. But the focus on childcare is what I'd like to talk a little bit about, because it affects so many of the social determinants of health. And so outcomes for families is directly related to our economy. As you said, those families that we're taught, we look at the data and we're thinking about individual families in your community, in my community, who are at high need. Those are the ones who are lacking housing, lacking transportation, lacking insurance coverage, and much of that can be resolved with dependable employment and the ability to get their child in high quality childcare that they trust, and when they need it, right? So there's so many important conversations happening around the Texas Prenatal to 3 network, all these collaborative conversations that are happening, but it all boils down to making sure that families have access to high quality childcare, and those that are in the workforce in childcare, which is a huge number of people in Texas, particularly women of color, that they have the ability to grow in their career of choice as a workforce, and that they have transportation, that they make enough to be able to, and that they have insurance available to them, and clear ways to become to realize their dream of becoming a better provider for the children and families that they serve, because this is a very important safety net that I think is a fairly new conversation for a lot of folks in the country, and one that we need to make sure is included in those social determinants of health, because it impacts all those determinants directly, especially around employment, and their ability to, there's a lot we could say there about their ability to take a day off of work and make sure that their child gets to the doctor, and then be able to take them back to a high quality childcare and get back to work. There are lots of factors there that are impacted by this one issue that's become a huge focus, and I'm really grateful for that.
Excellent, Anna. That really helps paint a picture for us. Thank you. Katie, what are your experiences?
Yeah, I mean, I think kind of the social determinants of health. It's a big topic of conversation. I'm thinking of it in terms of kind of the five big buckets of social determinants, and I know some models may have others, but there's the built environment, the neighborhood in which people live. There's health and access to health care as the second bucket. Then we think about social and community context, those relationships that they have with others. Then education, as Anna was talking about, and then economic stability. So all of these things are completely intertwined, and you can't think about them really. We try our best a lot of times to try and silo them, which is I think what you were kind of pointing to earlier. But really, they're all so interconnected, and we have to try and attempt to address all of these issues. So at a risk of siloing, I'll stay in my lane in terms of my knowledge and understanding of these issues, and I think focus in on healthcare and health coverage, access to health coverage. I think a big challenge is that parents and low-income adults don't really have access to health insurance here in Texas. If you're a parent in a family of 3 in Texas, and you make more than $3,733 a year, that's $3,700 per year, you make too much to be eligible for Medicaid. So that parent could not have coverage. Their child would be eligible for coverage, but that parent would not. If you're an adult without kids in Texas, and you're not elderly, or you don't have a disability, you're ineligible, period. You can't get coverage. So this is a huge problem. We can't expect families to be healthy and to be thriving in their communities if they can't access health care when they need it, because the cost is too high and they don't have health insurance. When we think about kids, and this is something that Jamie mentioned in the introduction, and that Amy mentioned in the data points, is that right now for kids that have Medicaid coverage, we have a really tricky system that requires families to jump through a lot of bureaucratic hurdles in order for their child to keep Medicaid coverage. So, in 2014, we started a system of periodic income checks where families could have their income checked in months 5, 6, 7, and 8 of the year when they have Medicaid coverage. These periodic income checks cause families to have to submit information back to the Health and Human Service Commission within 10 days of that request being made to the family. If the family doesn't get that paperwork back to HHSC within those 10 days, their child loses coverage. And, they may not know that until they show up at Dr. Gamble's office or show up at the emergency room, it sounds like, in her situation. They may not realize that their Medicaid coverage has been cut off, and then they're in a really tricky situation. In a lot of cases, the state ends up paying for that anyway because they have to pay retroactively. So my argument is it'd be better for the state just to keep the kids covered and not have these periodic income checks, which is something we're working on this legislative session. So I feel like I've gone off on a tangent, but all of this is to say that there's a lot of work to be done to make sure that kids and parents have access to health coverage so they can access quality health care. That's one piece of the social determinants of health that can help make sure that families are able to thrive in their communities. So I'll stop blabbering on and I'll let Dr. Gamble jump in.
Katie, that was a phenomenal answer. We were very grateful for that. And I think one of the things that was so striking was that just with a little over $3,000 worth of income, that people are not eligible for Medicaid in Texas. And that is tragic. And certainly with families having a verified income on a monthly basis, we know that that's going to directly impact access for their children. And so then, Dr. Gamble, they end up in your clinics and in your emergency rooms without any kind of coverage. Tell us a little bit about what that looks like for you.
Yeah, so I want to say, Katie, I love every word of your tangent. It's so true. And just kind of in general, I was, thinking about this as Anna and Katie were talking about, what this looks like for my patients when I see them. And, there's disparities based on the social determinants of health in every disease that I treat. So literally every single illness that I see, there's disparity. So just one of the most common things that I take care of is kids that have asthma. And so children of color, children of lower socioeconomic status, children whose parents have lower education attainment levels, all have worse outcomes. So these kids are more likely to have an asthma exacerbation or an asthma attack. They're more likely to be admitted to the hospital. They're more likely to have to go to the ICU. They're more likely to die from their asthma. And even when these kids are not actively sick, they're not in the hospital, they've decreased asthma symptom control, which makes it harder for them to play, makes it harder for them to exercise. It makes it harder for them, they miss school, they're missing out on growth and development. And so the negative impacts of their well-being branch out and multiply far, far beyond not being able to breathe from asthma. And they contributed not only disparities for that child, but they're compounded through all of these other far-reaching impacts, and they're passed down over generations. So, it's really impossible to truly get a sense of all of the impacts from these disparities that we see. And there's all kinds of systemic reasons for this, right? So sticking with the example of asthma, just like Katie mentioned, the different domains of social determinants of health. So we think about housing quality. Is there mold in the houses? Is there something, allergens and cockroaches are known to be associated with asthma exacerbations? How is the neighborhood air quality? Are there factories or pollutants nearby that are making children more likely to have asthma exacerbations? Do they have access to prescription medications? Do they have transportation to get to the doctor to get the prescription? And then when they get to the doctor, do they have the insurance coverage to pay for the visit? And beyond all of this, so if they're able to overcome all of these obstacles, all of these barriers, and they walk in that door, they're still faced by elements of bias and systemic racism within the healthcare system that inhibit their care. So, it's so clear why we see these disparities. And why these barriers isn't a strong enough word, but it's the one that I have, that, they impact every single illness that we see. And the conversation thankfully has shifted a little bit, because I think we used to say that there was genetic factors or poor life choices. And that's absolutely not true. Like, these are not a result of a genetic difference. They're not the result of a poor life choice. These are the results of powerful systemic inequalities and inequities, and they're perpetuated by policy at every single level. So also a little bit of a soapbox and a tangent, but I think such an important question.
That's an excellent response, and I want to stay with you, Dr. Gamble. So, in your work as a pediatrician, how is income volatility, which essentially is low-wage work plus a lack of consistent hours, how has that affected health conditions for Texas families?
Oh, another good question, and one that I could talk about for a long time. I think the theme of this whole panel, I think, but economic security is critical to health in so many ways. Study after study has directly linked economic insecurity with poor health outcomes. And I think, like we've mentioned in several different ways, there's countless reasons for this connection. The ones that we understand, and then there's ones that we don't yet understand. But it's this complicated web that includes all of the things that we've been talking about. So healthcare access, transportation insecurity, food insecurity, access to quality childcare. But there's also some more nuanced branches to this web, I think, that we don't talk about nearly enough. And we've learned that even hormonally, that families that are living under the chronic stress of economic instability have increased cortisol levels that have devastating health consequences. So really, I mean, there's so many components to this. But for all of these reasons, I think economic security is really foundational to health. We spend a lot of time putting together solutions to all the problems that kind of pop out from this foundation. But I think we really need to work to address the foundational problem of economic insecurity, and income volatility is a huge, huge component of that.
Yeah, it's something that probably doesn't get talked about enough, to be honest. And certainly we know that families who have low-wage jobs, you know, their income is going to shift from week to week because they're not choosing the shifts that they get to work. You know, most of us have probably been in a minimum wage paying job or a low wage hourly paying job at some point in our lives. And I know when I never got to determine what hours each week I would work. And I never got to say, I want to have a consistent amount of hours on a week to week basis. And so people who are already in difficult circumstances because of the wage rates are thus even doubly impacted because they can't predict what their income is going to be like on a monthly basis. And then certainly during the pandemic, that has been an absolute roller coaster for families. And so thank you for speaking to that. And I want to shift back to Katie. Katie, health insurance in the U.S. is tied to employment for most households. Speaking of the economy, how have job losses during the pandemic affected healthcare access for Texans that may have had health insurance prior to the pandemic?
So that's a great question. And we know from the Kaiser Family Foundation, their most recent estimates are that about 1.6 million Texans are estimated to have lost their job-based insurance just between March to May of last year. So that's our best estimate, 1.6 million Texans just in those first few months of the pandemic. So we know that those families, you know, are now having to face the complex process of potentially accessing Medicaid and CHIP for their children, which, as we just talked about, they're not going to be able to access it for themselves, most likely, but they may be able to get it for their children, or they may be able to get a plan through the marketplace with a good subsidy so that they can access health insurance. But it's a big concern. You know, I don't think that we have a full picture yet of just how far-reaching the loss of employment-sponsored insurance is, and what it has done to families, and what this will look like for employers moving forward. You know, a lot of employers have been hurt in the pandemic as well, when when this is all over, are even fewer employers going to offer employer-sponsored insurance, or offer, it's just really, there's a lot of unknowns in this situation. There has been a rise in the number of children that have been able to get Medicaid. As many folks on the call may know, as part of the public health emergency, there is a maintenance of effort in place that in order for the state to pull down this boost in federal funding around Medicaid, they have to keep kids enrolled in Medicaid, not just kids, anyone with Medicaid. So it could be pregnant women with Medicaid. They have to keep their coverage through the public health emergency. So what's good is we know that kids and moms with new babies, that they have their Medicaid coverage through the end of the public health emergency. I think a question came up in the chat about this, that they are hearing that HHSC wants to reduce the kids on Medicaid by 8% after the emergency period ends. And they were asking about our thoughts and how does this impact the Medicaid and CHIP levels. I think this is a great question. This has been coming up in a lot of legislative hearings because the number of kids on Medicaid is higher than it has ever been because of the maintenance of effort. And what does this look like towards the end? The good thing is Texas is already starting to do those renewals with kids and families to see if they're going to remain eligible. So we're not going to have like a huge dump at the end of the public health emergency like some other states. Some other states haven't started this renewal process to check on people's eligibility. So when it comes to the end of the public health emergency, they're going to have tons of families that they have to figure out what to do with. Luckily, that's not going to be the situation in Texas, but we can expect that once the public health emergency ends, there will be a large decrease in the number of families that have Medicaid because they've been required to maintain it. I hope that answers the person's question and answers your question about employment-based insurance and the loss of that during the pandemic.
Yeah, and I'm gonna turn to Anna and ask her a specific question. But one, Katie, a question that arises from your comment that I would love to hear you and Dr. Gamble speak to after we give an opportunity for Anna is, so what's our pathway forward for healthcare access in Texas, both for our children and our families? We know that elected officials in Washington are proposing a series of, kind of lobbying back and forth, a series of changes, or maybe improvements to the healthcare system. But we know that we have very strong opinions on all sides of that particular issue. But I'm asking the two of you, from where you sit, what is our pathway forward to ensure that everybody has access to healthcare in Texas? And so I'll look forward to hearing you speak to that. I know it's a big question, and I'm sure that you could each write a book on it. But I think for the good of the audience, I think that's something that we all want to know from experts such as yourselves. Anne, I want to turn to you and ask you a question about housing. This is a little bit different, but housing certainly is critical to a child's health and well-being. With your experience, you bring a level of experience both inside of Texas with your work, but also outside of Texas. Do families in Texas have adequate access to stable housing?
So it's a really complex issue. And again, another issue, and thanks for the question, Jeremy, it's another issue that COVID has really shown a light on the complexity of the issue and to some of the really kind of the pitfalls that families fall into related to housing. And so when we look across the state, the eviction moratoria that have occurred because of COVID did solve some problems for some families, but specifically where there were local moratoria that were more closely enforced. So if we take Austin, for example, they had a local moratorium that was put in place in the very beginning of the pandemic, and they had not only 900 eviction cases filed in their courts during through the course since last spring through the course of the summer when the eviction moratoria were really a big focus. They should continue to be a focus, but they've the conversation's gone by the wayside a little bit. Let's take that in comparison, direct comparison to Houston, that had initially they saw 13,000 eviction cases come through their courts after the moratorium, and then a total of 24,000 evictions have been filed in Houston since 1 year ago, and I'm sure that number is probably higher than that. Now, the complexity of the issue arises when you realize that there are a huge number of immigrant families and people of color, families of color, who are self-evicting because they don't understand, they don't have great guidance on how the law works and what their what their rights are when it comes to housing. And so we're working with a lot of partners. They're coming to the Texas Family Leadership Council every week, and we're having in-depth conversations. Actually, we're having another one in a couple of weeks to kind of check in on the moratoria and see how they're going across the state. Because as you can imagine, being a child, trying to figure school being done differently, food being done differently, all of the referral systems around children have been challenged. And to also have the challenge of figuring out where we're going to live tomorrow or next month, or do we pay the bill or do we take the risk that we're going to be evicted? You know, the electric bill or the eviction, you know, that's a horrible challenge to face. And because of the threat of eviction, families are also making really difficult choices about other areas of their lives, like their children's health, like going to the doctor, like buying medication. And so I think I really appreciate you bringing it up and giving us time to talk about that. And so again, I'll just reiterate, families being able to understand what their legal rights are around eviction are as important as the moratoria. So I don't want that to get lost. It's easy to say, okay, now our city has a moratorium. Well, Houston did and Austin did. We got to look at what the difference was and why there was such a huge disparity, and what was really effective and what worked for families, and also figure out how do we measure, how do we gather data around kind of this self-eviction issue that's become a huge conversation.
I feel like I'm taking copious notes over here and learning new things from each of you. I think, you know, if we were all in person in Austin, I think this would be the point where everybody, you would receive a standing ovation and you would exit off the stage, but people would keep clapping so that you would come back out for an encore for another question or two. But you all are doing amazing work. And I want to thank you for your commitment to the cause of people who don't have people advocating for them on a daily basis. The fact that you all are working on a daily basis for the public good is inspiring. And so we are very grateful for your commitment to the cause. And so where do we go from here? So if we have an encore question, you know, where do we go from here? And Dr. Gamble, I want to pick on you first, and specifically as it relates to healthcare access. Obviously, we can't be a just society when people don't have access to healthcare. When people's only preventative treatment is after they've gotten so sick that they get taken to an emergency room. That's not only not financially viable, it doesn't treat people as our equals. And so where do we go from here?
Thanks, Jeremy. I mean, if I had the answer to this question, we wouldn't be having this panel. We might not even have jobs. So I wish I knew and could answer it in the, couple minutes that we have left, but I can't. But what I do know is that, Medicaid works and covering kids works. It makes a difference. We know that. And we also know that, so let's cover kids and let's stop kicking them off that coverage. Like, I think that's kind of a first basic step that we need to take and can have some really, really important impacts. Because, when a child is sitting in front of me, like I said, I take care of hospitalized kids. So these kids are sick. They're having to stay the night in the hospital. They're scared. Their families are scared. Most of the patients I see, it's one of the worst days of their life. And to be facing that, and then all of the obstacles that it took for them to get to me that I talked about before. I mean, let's take one thing off their plate and make sure that they have healthcare coverage so that, when they're facing that worst day of their life, they don't have to worry about bill after bill that is coming for months afterwards and causing them to lose their homes or to not be able to provide food for their families or all of those other factors. So, I mean, that's, I think, the very first basic step that would be really, really important.
Good answer. Thank you. Katie, what are your thoughts?
Yes, I agree that is a good answer. That's actually, I have three things I think we should do, and that could be accomplished this legislative session should our legislators decide to make that change. Just like Dr. Gamble was talking about, ending these periodic income checks, making sure that kids that are eligible for Medicaid can get and keep their Medicaid coverage is a top priority. There's a bill, House Bill 290 by Representative Cortez, Senate Bill 39 by Senator Zaffarini, that would do just that, would end these periodic income checks and would rely on the annual renewal process, which we know is more reliable. This could help prevent over 65,000 kids from getting kicked off of Medicaid simply for excessive bureaucratic hurdles. That's a large amount of kids that could receive better health care because they know they have coverage. The second thing I think that we could do is to pass 12 months postpartum Medicaid coverage, making sure that right now moms lose their coverage 60 days after giving birth. So, imagine having a 2-month-old only to realize that you don't have health insurance anymore and you can't access anything that you need for your physical or mental health care needs because you don't have that comprehensive Medicaid coverage. There was a bill heard today by Representative Rose this morning at 8 a.m. heard in House Human Services that would do just this, that would expand postpartum Medicaid coverage to 12 months postpartum. And then the last thing I would say is expanding Medicaid in general, or whatever Texas wants to call this Medicaid expansion. But I think that we've shown that it's really hard for low-income parents and low-income adults in general to get health coverage. And so we need to make sure that families and low-income adults have an option to get coverage and get the health care that they need. So that's my wish list. If you can make that happen, Jeremy, I don't know if you're writing this down so you can send it over to whoever's in power, but if you could get those three to whoever it is, that'd be great.
How about we just elect you, and I think we'll be in good shape. If the three of you are our representatives, then I think we'll all be better off in Texas. Well, Anna, how would where do you see us going from here?
Yeah, I might get fired if I don't say this, and I would say it anyway. But I have three things. One of those is collaborate. Like, we have to continue to collaborate. COVID has opened the doors for what I call true collaboration. As you mentioned, Jeremy, I've been in a lot of quote unquote collaborative groups across the nation on lots of different issues around children and families. But we have the opportunity to do it and do it well and be an example to the rest of the country in Texas. And so I would just say we've got to continue to collaborate. We've got to continue to also support the terrific legislation, some of which we've heard about today. There's also the International Relations and Economic Development hearing by Chair Button in the morning at 8 a.m. That's going to talk about all those childcare issues. So if you kind of tuned into those childcare issues and thinking about that effect on social determinants of health, we've got to band together and support effective legislation and policies and share the data that informs those policies so that we're all coming at this at a level playing field. And then the last thing I would say is, and I've been saying since for an entire year, is we have to continue to innovate. Those of us who maybe aren't direct serving, who I don't have to spend my day figuring out how to get food out to the families in my direct neighborhood. So what I should be doing is innovating and figuring out what innovations are working, do some trial and error if we have to, get some planning grants out there. Let's get some of those seeds of innovations that have been forced by COVID, and let's make hay while the sun shines, if you will, and just keep innovating for those of us who have the luxury to do so.
Excellent response. Anna, thank you for your work and for what you're doing to make Texas a better place for everybody who lives here. And Katie, thank you for your knowledge and your work and your commitment to the cause. And Dr. Gamble, we're very grateful that you took time from all of the things that you're responsible for right now to be with us this morning. I know that I'm grateful for having been able to listen to you for the past hour. And Amy, we're grateful for your presentation and the work that Texas Kids Count represents. We're grateful for all of you. And with that, I want to turn it back over to Jamie with Methodist Healthcare Ministries. He has consistently shown leadership in the state of Texas to ensure access to both food and health care and stable housing and economic security. And so we are grateful for the leadership that MHM continues to provide the state of Texas and for your role in it. So thank you.
Well, thank you so much, Jeremy. I want to thank Amy Connaught-Narbutis and every Texan for the thorough research done on this year's Kids Count report. I also want to thank Jeremy once again. Great job. Anna Hardaway, Dr. Lauren Gamble, and Katie Mitten for the work they do on behalf of Texas children and for sharing their professional expertise and feedback on the data and policy recommendations shared in this report. All children deserve the opportunity for a healthy life. Yet the findings that have been presented to you today clearly point out not all children in this state have access to good health coverage, to food and economic security, as a result of rooted inequities in our public systems. A number of policy recommendations have been shared this morning, and we ask for your help in promoting and supporting these efforts at all levels of government, be it federal, state, county, city, and your local school boards. To eliminate food insecurity, we ask our federal and state lawmakers to fund and strengthen our Supplemental Nutrition Assistance Program and Women, Infant, and Children's Program for adults, new moms, and babies. The impact of COVID-19 and recent winter storm Uri on a family's ability to purchase food makes this and other policy recommendations more urgent than ever. Access to healthcare services and coverage is truly a right, not a privilege. As one of 12 states in the U.S. that has not implemented Medicaid expansion, Texas lawmakers have the opportunity this legislative session to pass a law that can offer health coverage to more than 1.5 million adult Texans, ensure 12-month coverage, continuous coverage for new moms, and 12-month continuous eligibility for Medicaid children. Providing affordable coverage can positively impact a family's financial security, allowing a steady source of income for housing, food, and education expenses. Supporting a living wage and employment benefits, such as paid sick leave, can place working families on stronger ground, financially as well as emotionally. And finally, our need for broadband infrastructure across all 254 counties is more pronounced now than ever before due to this pandemic. Internet connectivity is no longer a luxury, but rather an essential utility, much like electricity and water. State lawmakers this session have prioritized the funding of state broadband plan and office, one that can draw down federal funds and offer grants to rural counties. Our call to action today is to ask you to engage a push for funding and passage of these policy recommendations. Learn who represents you in Congress, the state legislature, county, and city offices. Make it a point to weigh in on government programs and policies. Register to vote and vote in all elections, especially those presenting state and local bond proposals that will ensure our public infrastructures remain fortified, not just for this generation, but for those that follow. Again, thank you for joining us today. To learn more about Methodist Healthcare Ministries and the healthcare, grant making, and policy work we do in our 74 county service area, go to www.mhm.org. Have a great day, and God bless. Have a great day. Bye-bye.